herpes tongue comes only when herpes is in the full mouth. This infection is caused by the herpes simplex virus 1 and can appear on inside of cheeks, gums, and top of the mouth. Most of the time, it can also appear on the lips. It is oral herpes tongue infection that has a unique appearance that makes them easy to diagnose by the patient and by the doctors. These wounds sometimes become visible and sometimes they do not appear on the surface. They can affect different paths of the mouth and cause pain. Oral herpes tongue symptoms most of the time appear on the tongue and in the mouth. It is an oral infection that affects the mouth herpes under the tongue and most people in the US suffer from it. What are the symptoms of oral herpes tongue? Oral herpes tongue or herpes under tongue can last for more than 2 to 12 days. The core symptoms of this infection are pain, itching, and burning. Can be caused by the herpes sore on tongue. After the soreness, wounds can appear that can be small, gray, and sometimes red. They can be dry, thick, and yellow in some people. The soreness and redness can appear on the lips, gums, under the tongue, above the tongue, throat, and on the cheeks as well. Herpes on your tongue can bleed, swell, and gums can become red. The nymph of the neck can become swelled. The grayish coating of the tonsils and throat can become sore like the ulcers. Most of the time, people can face breakouts and other symptoms as well. It depends on different people and the symptoms can vary a lot. It is better to visit the doctor for better tongue herpes treatment before the signs will become severe. Once this infection will develop in your tongue or any other part of the body, it is not possible to cure it. There is no information about the people who have cured of oral herpes tongue because this will last for a lifetime. What are the different stages of the oral herpes tongue? There are mainly 3 general stages of herpes on the tongue and it is necessary to take tongue herpes treatment at the right time. In the first stage, infection is developed in the body. The HSV-1 enters the skin or tongue and membrane and reproduction. In this stage, all the symptoms can appear or no one will appear. Oral herpes tongue beginning spends most of the time in an inactive state. It can migrate from the root to the spine and continues to reproduce. In the third stage, the virus can reactivate and the emotional and physical stress can start to appear. The cold can lead to fever and soreness or breakout. Most people develop this stage at a very young age and they never face a single breakout. In the beginning, breakout and soreness can happen. After some days, inflammation in the wound will start to appear and wounds will convert into red and gray cuts. After 3 to 5 days, the cuts can be filled with fluids and they will become highly painful. After some days, the healing process will start to begin. If herpes on back of tongue will become severe, you will have to take the tongue herpes treatment. What is the right treatment for oral herpes tongue? If you will visit the doctor for the herpes simplex tongue infection, he will give you antiviral drugs. He will give you different medicines, pills, and creams for increasing the healing process. If you want to treat the infection at home, you have to use the lip balm with sunscreen for lip protection. To reduce the redness, you can use the cold compress that will improve the healing process. In case of pain, you can use the painkillers that have alcohol. Amino acid supplements and cream are also beneficial for tongue herpes treatment. Can oral herpes tongue be transmitted to others? Oral herpes tongue can be transmitted from one person to another that is infected. If you stay in contact with the infected person sexually and touch, then this infection can also develop in you. Most people kiss their kids and kids can be affected by it. The intimate couples can become affected by it. If you will use the toothbrush or silverware of the infected person, the virus can be developed in you. If you feel herpes sore on tongue, then you must stay away from other people to protect them. The infection will start to heal after 1 week to 2 weeks, but if the infection is not recovering, you must visit the doctor. Oral herpes tongue can vary from person to person in the healing process. This infection will never go away because there is no permanent treatment for this infection. Oral herpes tongue. Oral herpes tongue bumps. Oral herpes tongue pictures. Oral herpes tongue symptoms. Oral herpes tongue treatment. Herpes tongue. Herpes under tongue. Herpes on tongue symptoms. Herpes sore on tongue. Herpes on back of tongue. Thank you for watching, and please subscribe to my channel for my upcoming herpes treatment videos.